My knee surgical practice consists of both arthroscopic and reconstructive surgery, and I do a very high volume of complex and revision surgeries. Examples of things I treat include anterior cruciate ligament reconstruction. I've done actually some research both in the biomechanics lab and on clinical outcomes of ACL reconstructions, and continue to develop my interest and practice there. I do a relatively high volume of revision ACL reconstructions and multi-ligament knee reconstructions, meaning posterior cruciate and collateral ligaments are involved. I also do a high volume of meniscus repair and meniscus allograft transplants, as well as articular cartilage restoration. That means treating focal articular cartilage defects with cartilage grafts or osteochondral grafts and related procedures. Moving kind of further down the line, and a large number, unfortunately, of sports injuries with accumulation of birthdays result in arthritis in the knee, and in some cases partial or total knee replacement is the best option for treating those. That's usually last resort, but I am doing both partial and total knee replacements in my practice as well, so trying to take care of the full spectrum of orthopedic and sports medicine knee injuries.